Okay, my name is Janel Glass. I'm a registered respiratory therapist. I started out here at Great Plains Rehab Services back in 1996, 95 actually. And when my daughter was born with some respiratory illnesses, I started out as a respiratory care aide, at which point I worked here as a respiratory care aide for 10 years, and then I saw that the path of respiratory therapists, they were needing more and more and more, and that the pay is a lot better. So I chose to go to school. It's a 4-year degree. It's a bachelor's degree at the University of Mary. Since it's local, I chose to do that, and was lucky enough to, when I was done with schooling here in town, was lucky enough to get hired back on here. So
what do you do in your job? What's a normal day like?
Well, we come in at 8 o'clock in the morning. We start our day with kind of looking forward at what patients are scheduled and what their needs are. It could be anywhere from oxygen setups to CPAP setups. They're all medical equipment. Oxygen is self-explanatory, but CPAP is a little more in depth. We do a lot of teaching with the patients. We spend a great deal of time of clinical teaching with the patients, making sure that they understand their disease process, their goals, their diagnosis, all that kinds of stuff. And there's a lot of reteaching because it's our typical patient base is elderly. However, we do work with infants on up to geriatrics. So
how many hours do you normally work?
40 is what we're supposed to be working. Sometimes that spills over. You know, if a patient's here at 5, we try to take care of them, and it could be 6 o'clock at night before we're done. But
so do you take work home with you?
Yes, we are on call. I personally love to be on call because I'm a new therapist. I've only been in it for 5 years as an actual therapist, so I do like to take a lot of call. So like I said, yeah, we do take it home because we are on call 24/7.
Even holidays?
Yes, weekends, holidays, yeah.
How would you describe the pace at which you work?
The pace? Oh, it could get pretty, a lot of times if you're the therapist that is seeing any patient that is not scheduled in the store, it's very fast-paced. We could be, you know, because we're home care, we have a 100-mile radius that we travel within the central part of the state here. We do go as far south as the South Dakota border, so we do go into South Dakota, just right over the border. So we do go quite a ways. So if we go out for a setup in another town, we can come back to a full load of patients when we come back to the store. So it can get pretty busy.
What were your favorite classes in college?
Probably chemistry. Yeah, chemistry. Yeah.
And why?
Because it was challenging. Yeah.
How has your education prepared you for your career?
Oh, a great deal. I don't know that I would even... It's a lot of critical thinking. A lot of the patient care comes with experience. So the critical thinking part of it, like the textbook stuff, definitely.
What would the starting wage for a job like yours be?
As I was saying, when I started in 2005 as a therapist, you first get your certification. You become certified respiratory therapist. In the Bismarck area, I believe I started out between $14 and $15 an hour. And then as I became registered, and that's another testing exam you do to become registered, your pay gets bumped up a few dollars.
What goals do you have in your career?
Right now I'm currently working on my big goal is to become a COPD educator. We have a lot of patients in this area. The demographics here are a lot of elderly, retiring patients, so with a lot of respiratory illness and chronic. So I'm working on a educator course right now. So,
what do you think it takes to be successful in this career?
Patience. You have to have patience because the patients that we deal with are all chronic usually. They have lifelong illnesses, and you have to have patience with them so that you can work with them and teach them the right way how to deal and what their diagnosis is. So
What do you find are the most difficult decisions to make?
Usually financial stuff, but those usually are typically, if we get stumped here, the managerial department, can help us out there, but.
You mean like for a piece of equipment or
Yeah,
helping a patient? Or?
right, because we also are supposed to be able to find the best mode of therapy for these patients that's try to be as inexpensive as possible, both for the patient and for us, but as a company. So I guess the money part maybe. Other than that, I think I see the challenges as something good, so.
Mm-hmm. Do you work independently or on a team?
Team.
Can you give us some examples?
Well, here at Great Plains, we have there's 3 to 4 therapists staffed per day. Each one of us has a role for the day. So if one of us is doing something with a patient, the others have to follow in, or the whole team, it can get out of hand pretty quickly. So we each do have a pretty vital role on a day-to-day basis. After hours, though, it is just the one person on call, so sometimes it gets a little hectic that way. So we do, after hours and weekends, holidays, we are on our own.